This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
Right, we used to have to take some leaps in our assumptions or decision-making. Now we have closer to real-time information to guide those. That's not the same as forecasting, which is still core to what we do at SG2, taking all the information you have and looking at the future thoughtfully, but real-time access to information to change what you're doing to manage your workforce, to manage your capacity.
Welcome to Sg2 Perspectives. Today, I have Bill Woodson with us to talk about his tailwinds for the year ahead. And I was excited to read what Bill put together on this topic recently because it was pretty optimistic. So I'm anxious to dig into it together. Bill, thanks so much for joining us.
Great to be here.
This time last year, the tone going into 2025 felt like we knew regulatory uncertainty was going to occupy a lot of our mind space. It felt like financial recovery was still making progress. What's the tone going into 2026?
The tone may be something we have hit a new plateau or a degree more of certainty than we had a year ago, with the understanding that the regulatory hits are going to come and maybe not exactly in the order that we're expecting them. The biggest ones won't hit until after the midterm elections, although the work requirements do come into play this year. In general, Trevor, there's an existing set of concerns around structural pressure, depending on the market that you're in, your overall financial stability, and the cost pressures. Those are universal. The degree will vary by the organization or market that we're working with, but more and more of our system members believe they've got something of a handle on it as they move into 2026 with a degree of optimism.
I was with a health system this week, really strong financial performance, growing market, commercial shares good, and they put some big numbers up on the stage for their whole director and above audience to see of their expected cuts. Not one big number, it's like 3 numbers over the next 5 years that they were going to have to hit. I think that's part of it, but systems are taking it in stride.
The range on that number is extraordinary. I talked to a member this week. Their number that they have to hit is something around 60 million, but we're hearing multiples of that in different health systems right now and how that's going to play out and which part of the cost structure, labor, non-labor spend, it's all kind of there. But I'm not hearing organizations say we won't be able to do it. It's an expected level of discomfort, pain, and let's take it on.
Yeah, that's a similar tone I've heard. You used the term in your recent post. We'll have a link in the description of the podcast. There's an appetite for bold transformation out there now. Totally agree. Because the 2 most recent markets that I was in, one is struggling. And if Medicaid cuts make it through there in the next few years, they're going to really feel it. And it's going to change an already tough payer mix for them. And I was in another growing market and both were talking transformation, but it looked different in both circumstances. How are you seeing systems and leadership teams talk about transformation?
Let me put it in a couple of different ways. At the base level, there is a willingness to act with more discipline on just prioritization. Here are the things that we can actually take on that must get done. Here's a shorter list than we've had historically. At the same time, there's a couple of big bets that we're probably going to make in different aspects of the business. Systems being comfortable saying, we know how to do both those things at the same time. And maybe they've matured their approach to what innovation is in the system at this point, or where that's supposed to be anchored, centered, organized, et cetera.
Do you think the product is going to be a transformation of the health system, or is that a bundled word that means changes, scale of cuts are going to feel bigger than maybe they have?
We tend to exaggerate, be wary of words like these when we throw them around like this. And the transformation on the workforce side will be the story of the next decade in healthcare, but positive events happening there that we can talk about. Breakthroughs in the use of AI with the beginnings of an understanding of what return on investment may look like, and only acceleration ahead for the impact that those tools will allow for us. And as I've mentioned in what I wrote about the adoption of real-time analytics, and then the term systemness, which is as amorphous as ever, but systems starting to put some boundaries, definitions around what they're going to take on with their systemness journey.
That's good. All right. I want to dig into those more. Talk about ambient scribing. This was a success story of technology adoption that I'm not sure I can find a parallel in healthcare. Why does it make you so optimistic about what might come next, whether it's in AI or tech adoption in healthcare or in the way health systems are using technology to support their workforce?
let's call it guarded optimism, because we tend to fall in love with certain technologies and platforms, and then the processes of healthcare catch up with us. Nevertheless, in every meeting that I'm in, I'll ask the physicians who are there, what are you doing with ambient scribing? What's the uptake? What's your attitude toward it? And it's universally positive with some caveats around that. But how quickly it moved last year is faster than anything I've seen in a long time in healthcare. And then the willingness down to say, okay, well, we've done this well at a reasonable scale with a number of physicians, mostly on the primary care side. We're going to move it into other specialty areas. We're going to get this on board with our nurse practitioners, anecdotally about we'll find uses for this potentially in the OR or the critical care setting. There's a willingness to say, we know what to do with these tools, but we haven't figured out all the underlying processes yet, but let's move forward. And let's also say that whenever I ask about ROI, most organizations have said, we're not measuring that yet. So far, it has been a change in workflow, quality of life for the physicians, positive feedback in terms of just culturally what it means for a medical group or our employed medical staff. Nevertheless, I was with one system at the end of the year, Trevor, and the COO of that system, it's a large system in the Southeast, said, no, we're fully banking on getting 2 more visits per day out of our physicians who have adopted the scribing technology. We're not sure how quickly we're going to hit that, but we're going to start building in ROI metrics. I heard from a COO of another system saying for many of our AI investments at this point, we're expecting maybe several years to go by before we see the true ROI impact. But that's not going to deter us because this is the biggest transformation in workflow that we've ever seen.
I saw at JP Morgan Chase this week, Common Spirit said they have 240 something AI initiatives, most of which are not point solutions or pilots, but they're system wide already. Even at a big system, that sounded like a big number to me.
It does. I'd love to know a little bit more about where they're hitting and what aspects of the organization, how much of them are administratively based or into the weeds of rev cycle or things around claims or ICD-10 or the nuts and bolts of running it versus what's really affecting clinical care on an ongoing basis. How much is in pathology, imaging, so many different areas where this can make an impact. In terms of our maturity models at Vizient, the earliest maturity is going to be in the administrative aspects of deploying these technologies. But again, I'm hearing some pushback on the cost of some of those solutions, given what they were doing historically. Even with a smaller workforce, the cost of the technology platform itself can be a bit imposing.
I had a revelatory moment, just happened to be sitting at lunch with someone who runs IT, big health system, and I was trying to pepper them with questions like this. And the amount of fires they put out during lunch would have been a week's worth of work for me. So it just showed me the amount that's already on their plate would be daunting for most. And so bringing in things that solve a problem or take something off their plate, most are just using what Epic's already providing.
When I ask questions about this, it's how much are you doing with your EMR vendor? And that's Epic, of course, being the top of the list, but also Oracle. And how much are you doing other solutions, best of breed or building your own? It's a little all over the place as we settle in this maturity. And in the backdrop of that, and you've been watching the announcements I've been watching about acquisitions in the industry, ChatGPT's rolling out of their healthcare specific consumer facing model, other companies getting more into the space of documentation, data, medical records. It's the amount of money flowing into the sector in healthcare that's amazing to watch.
I like that you started talking about it as a workforce innovation. You said the next decade is going to be about workforce innovation. Well, in my notes, I put teeing up this question to say the last decade was about workforce innovation. Why do you remain hopeful that there's good momentum, more we can change?
We have no choice. It's as simple that we've run out of the constraints, or we're tied with constraints we've never had to deal with before, which is retirement age, depending on state we're in, around 60 or coming quickly with a percentage of the nursing workforce, physician workforce retiring, who's going into new professions. I guess why I'm optimistic is that we're going to be smarter about where we use the precious workforce we have. We're seeing great stories about health systems scaling up their training programs that they've built, not just for physicians and nurses, but for allied health professionals and tech, you name it, gaining some traction there, loan forgiveness and programs that are fully backed by the health system's capital and operating budgets there. And that ties to a willingness to innovate, experiment, let's try it this way. And then we'll attach it to these new technologies that we have, whether it relates to patient flow in our systems, how we're transferring patients, how we're managing capacity, understanding that we can and we will do more to scale the workforce capabilities that we have at the moment and that will incrementally grow.
Similarly, progress on analytics and market data feels like it's making steady progress. I'm not sure we made a leap in the last few years. It's probably moving slower than at least I had hoped or anticipated. What did you see that made you feel like it was really solidifying or accelerating in last year and that it can keep going this year? I mean, Sg2 certainly stepped our game up in this department last year.
Yeah. And let's be clear. I think it's a relatively small number of health systems that are moving at a fast pace on this as they seek to integrate so many of their different data streams in real time. And to me, that's what I've seen is integrating clinical, financial, operational, strategic data together in real-time scoreboards. We saw that at Tampa General this year, and I believe they're using Palantir for that, which is making strong inroads into health system operations. And then it's more the decision-making that health systems are using with the data that they have and centralizing the data function more effectively, but allowing that to support local or market-based decision-making for the system overall. There's maturing of the function, even as the technologies or infrastructure are also advancing at a really rapid pace.
I totally agree with all that. And I also think part of it is people who just grew up as strong data folks are now either aging into or progressing into more leadership roles. And that level of data fluency and health systems is moving up the administrative hierarchy.
Right. We used to have to take some leaps in our assumptions or decision making. Now we have closer to real time information to guide those. That's not the same as forecasting, which is still core to what we do at Sg2, taking all the information you have and looking at the future thoughtfully. But real time access to information to change what you're doing to manage your workforce, to manage your capacity. Capacity is a big part of this story, but also strategically about let's look at our service line scorecards. Are we really making the progress on those that we said we were going to make? And how are we doing in that particular ambulatory site this day? How quickly are we bringing that on? It's kind of an exciting time, I believe, just because of the access to information that's available.
It goes to the idea of systemness. Systemness was maybe the buzzword of 2025, but it's certainly a buzzword. But I really agree with your point that by the end of the year, most systems had a vision around what systemness was going to mean, and it moved from being a buzzword to taking action. I'm not sure the visions were uniform across and within a system. People, in some cases, make your own definition of what it means. That was reinforced to me when I was with the leadership team of one hospital within a system. And the proportion of our time that was talking about operations at that specific hospital versus the system, maybe we spent 5% talking about the system and the rest was focused on internal this hospital, which is probably about expected. What did you see as success stories around systemness last year?
Yeah, at the largest level, it's organizations settling in not just at one hospital, but across multiple hospitals about an approach to operations, structure, scale, how it's done in a consistent basis, with still leaving some local autonomy and a firmer understanding of what truly is a system level decision versus what's meant to be local, and being more comfortable with doing both of those at the same time. I take this a whole bunch of different ways. Organizations that have been together for a long time, finally taking that look at service distribution that we've talked about for years, Trevor, but also asking the tough questions about, well, what's really differentiated about this one specific campus and our organization, and how are we going to defend that in the marketplace? Ties to the broader consumer journey that every organization's on around access. And that continues to move across the board on the patient flow, capacity management, deploying advanced practitioners, let's say to support gastroenterologists or oncologists to free up their time. We had a couple examples last year of behavioral health urgent care centers supporting the system and the EDs more effectively across the market. And what are we doing with virtual visits? We've been watching this for so long, but the number I keep hearing is let's shoot for 30% of our visits being scheduled through virtual platforms. And I believe the CEO of Sutter talked about this past week at the JP Morgan conference. And a system like Ochsner has been doing that for a long time. So we're finally moving the needle on the access pieces that have been in play for a while, tied to a broader, honestly, dissatisfaction of consumers in the marketplace. So we have to respond. If you're truly going to differentiate, it has to go through that access consumer lens.
I agree with you that systemness is just becoming an expectation, especially of the corporate or centralized functions. And they acknowledge things are still so disparate and siloed. A system I was talking to just this week, facilitating a discussion, thinking about opportunities to do things a little more consumer focused. And at the end, they said it was actually really helpful to do this as a table because we had learned about a bunch of different initiatives that the system has in place that different people at the table knew about, but everyone didn't know about. So still progress to go, but they expect to be better at it.
I'm impressed. You've already alluded to it, that there are new types of leaders with different backgrounds that are entering senior roles, and that's making a difference. One of the quotes we had this year is from a large system that said that their leaders now are able to have an emotional detachment from their individual role when they're making a system level decision. And that's a cultural transformation that we've been waiting for a long time. And we have started this discussion with the maturity potentially of an innovation function or an approach to innovation and transformation that does seem to be making progress as well.
All right, this time next year, at the end of 2026, if things go the best they could, what are a couple things you hope you'll be able to see?
Continued stability on the financial market structure side. Underneath that is a continued maturing of system structure service line developments, which we've talked about for more than 15 years, but we're seeing some maturing there that we'll have a couple of pieces on this year, Trevor. And then the workforce story continues in lots of positive ways. We'll see so many more of those stories tied to the continued adoption of AI tools as well. In some ways, you can describe these as incremental, but beneath that, I'm more optimistic we'll have some bigger wins than we've seen in the last few years. A little more maybe liberation to take them on as the finances start to develop a slightly clearer picture.
It's a pretty optimistic outlook for the year, and thanks for guiding the places that you're suggesting we stay focused on. If the news maybe gets bad in the short term, we can stay focused on the positive long-term picture. Thanks for that.
Talk to you in a few months. I hope it's the same.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and/or follow us on Twitter and LinkedIn at Sg2 Healthcare. If you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, Sg2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You can find them at Vizient /podcasts. Have a great day.